Cervical vertigo symptoms and diagnosis. In a study conducted recently, to investigate the causes of vertigo, it was found that about 65% of cases were due to cervical spondylosis. This is because neck receptors are responsible for maintaining and controlling movements of the eyes and the body. Signs and symptoms of cervical vertigo. The most commonly observed signs and symptoms of cervical vertigo are dizziness or vertigo, often associated with a headache, imbalance while standing or walking, neck pain with postural imbalance, neck pain referred to the shoulders, hearing loss or tinnitus, ringing sounds in the ear, swimming sensation to explain lightheadedness or a sensation of floating, nausea and occasionally vomiting. Causes for cervical vertigo. Whiplash injuries or trauma. A study conducted found that whiplash injuries caused persistent dizziness or vertigo. Cervical spondylosis. Cervical muscle spasm. Degenerative cervical spine diseases. Abnormal nervous input into the vestibular nucleus from the upper cervical region. Occlusion or compression of the vertebral artery. Migraine-associated vertigo. In a study carried out, it was observed that about 65% of adolescents with a migraine experienced shoulder pain and cervical pain. Diagnosis of cervical vertigo. It is important to rule out other causes for dizziness before diagnosing a person with cervical vertigo. Benign paroxysmal positional vertigo, or BPPV, is often misdiagnosed as cervical vertigo. Reproducible vertigo by manipulation of the neck and pain on palpation of suboccipital region and muscles of the neck, chest, and back are the only examination findings in patients having cervical vertigo. Digital subtraction angiography (DSA) is an invasive investigation procedure to diagnose cervical vertigo in high-risk cases. Cervical vertigo may also be present for days to weeks after having a neck injury. Since there are no definitive tests or gold standard tests designed especially for cervical vertigo, it is difficult to diagnose it. Things to avoid. Avoid sitting in one place for a long period of time. Move around after every hour or so. Avoid foods having caffeine. These can make you dizzier. Avoid extreme and jerky neck movements. Avoid alcohol and smoking. Avoid sugar and acid-forming foods. Avoid massages if there is any swelling, spasm or inflammation. It can further increase the pain instead of relieving it. Thanks for watching. Like and share this video.